Hey, Margie here. Today we're talking about a very important topic when it comes to bone health, IBS, or Irritable Bowel Syndrome. And IBS affects between 30 to 65 million people in the United States, and it's a root cause of osteoporosis. And there's so much that we don't know that's going to be talked about in this episode. And I'm really excited about my guest today, Dr. Izabella Wentz. And Izabella is an integrative pharmacist and New York Times best-selling author known for her work uncovering the root causes of chronic health conditions. She has a brand new book that was just released today, IBS: Finding and Treating the Root Cause of Irritable Bowel Syndrome. And this explores why IBS is can be an imbalance in the body and what people can do to begin to heal their gut. And the good news is what you do for your gut helps your bones. So this interview is full of so much great information. Stay tuned. Welcome, Izabella. I'm so excited to have you here on the podcast. Just a shout out, your new book is just unbelievable and so needed today. So I'm really thrilled to talk about this with you and share some insights and things that people can do in the community. So welcome.
Thank you so much for having me, Margie. It's such an honor to be here with you.
Oh, well, thanks. It's an honor to be here with you too. So anyway, it's so interesting because this is so appropriate for for the people who listen to my podcast who are really interested in their bones, because there's been several population studies showing that people with IBS have about a 30 to 65% higher risk of osteoporosis. Which really highlights, even in the research, the connection between gut health and bone health. And it's the very first thing when people ask, they have so many things going on. Where should I start? And it's always the gut because it plays such an important role. But do you want to share why this plays such an important role in bone health? Like what areas it could impact?
Well, definitely. So, interesting thing about gut health is it can impact so many different conditions, whether you're talking about anxiety or autoimmunity, whether you're talking about fibromyalgia or even bone health. And a big part of that is when we have irritable bowel syndrome, our intestinal tract can really prevent us from properly absorbing various nutrients. And nutrient deficiencies, as you know, can lead to a whole host of issues, especially with osteoporosis.
Absolutely. And the thing is that and then so many of the root causes, which we'll get into with IBS, are also root causes of osteoporosis. So it just ties in so beautifully. And the good news is there's so much that can be done. And that's why I love your book, because you really lay out what the problem is, how to figure out root causes, and then what to do. So I think this is so helpful. But let's start from the beginning, just about what IBS is, because it's not a typical diagnosis, and you have a very funny term for it. So you want to share what kind of diagnosis you call IBS and just what it is, because some people are listening, they're like, well, I've sort of heard of it, but
Well, it's very common. So it can affect anywhere from like 25 to 45 million people just in the US alone. It accounts for 12% of primary care visits in the United States, and it's a chronic disorder. It impacts the GI tract. This can lead to abdominal pain, bloating, changes in bowel habits. For some people, they might have diarrhea all the time, others might have constipation, others might have a mix of the two. And it is something that I consider a wastebasket diagnosis because it's a label given to your symptoms, but it doesn't actually inform you on what's causing the symptoms, and it doesn't actually inform proper treatment. I feel like if a diagnosis is like a good diagnosis or a true diagnosis, then we should have a very informed and clear treatment plan. With the current approach, conventionally conventional medicine approach to IBS, less than 25% actually get symptom relief within 6 years. And so I feel like it's one of those things that people it's descriptive. It's like, okay, well, you have an irritable bowel tract, and so you're having symptoms like constipation and diarrhea, but the cause of it, the diagnosis doesn't provide us. And so my book, finding that in treating the root cause of irritable bowel syndrome, I really focus on the 20 plus different causes that could be behind those symptoms. And some of these causes might be like small intestinal bacterial overgrowth. It could be oxalate issues. It could be SIBO, SIFO. It could be parasites. It could be nutrient deficiencies. And every different cause has a different treatment option. And once you figure out the cause, you can successfully treat the condition. I'm very passionate about gut health and IBS having an autoimmune background because many people who have a history of IBS end up developing autoimmune conditions. They can also develop, osteoporosis potentially because of the malabsorption, the inflammation, even sometimes the medications used to treat IBS can also cause a lot of side effects.
I think that was so I mean, there's a lot of things that are so interesting, but I think when I was reading your book, I just thought so many young people have irritable bowel syndrome or have diarrhea or have all sorts of gut issues, and and that they've actually found that that precedes autoimmune conditions is something and, a lot of people just what I found is a lot of people just think they have to live with it. "Oh, everybody has this, no big deal." I remember a young person was telling me there's like a line going to the bathroom. Like people just have issues and they just don't think much about it. But that was so interesting that it shows up before the autoimmune condition. How many years is that?
Anywhere from 5 to 15 when I went through functional medicine training through IFM, that was one of the things that really stuck out in my head, that this can occur. And personally, for myself, this was my history. I had IBS diagnosed when I was in pharmacy school. And then about 6 years later, I got a Hashimoto's diagnosis. It is something that I've seen again in my clients as well, where we go through a history and a timeline, a health timeline of what was going on before you got sick and kind of what other health challenges did you have before you got this current diagnosis and starting from birth and where are you today? And I have seen this pattern quite a bit. I even had some clients who, like with really early Hashimoto's where IBS was their like primary complaint, right? But they had additional testing done and they were found to have Hashimoto's antibodies. And we were able to work on their IBS and prevent the progression of their Hashimoto's. So that's been something that I really hope to raise awareness on how important it is to address IBS when you have it, because it can lead to a whole host of health issues down the line.
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout that contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com, again, /osteoporosis exercises, or you can click the link in the show notes. Now back to the show. That's my approach too, this root cause approach, which I love, I have to say. It's so important. You bring this out in the book in terms of red flags that you really do go to the right person, not just your family medicine doctor. That's such a good point. You see the gastroenterologist if you have issues who can really rule out anything serious, cancer, make diagnosis. We don't want to forget about that because that is that important. But once those things are ruled out, that's when people are either put on the medication or they're sort of left like, okay, nothing serious, move on. You just have IBS, no big deal. And it is a big deal. As you said, it can lead to so many other things, and it's a root cause of osteoporosis. So I think this is just so important in terms of because what do you see as the typical treatment? So they ruled out cancer. They've done the endoscopy, they've done the colonoscopy, they've ruled out things. And so what do you typically see the conventional treatment of people with IBS is when they group them together?
Yeah, so I would say interestingly, only about 13% of IBS patients ever see a gastroenterologist. So they're usually diagnosed without doing any lab testing. It's basically a diagnosis that they get based on their self-reported symptoms. So they go to their doctor, they're like, I've got diarrhea, I've got constipation, stomach pain, so on and so forth. And they're just giving this label. And usually the treatment approach is very basic. So they might be told to stress less. They might be told that they could benefit from sometimes probiotics or fiber. They might be told, given some prescription medications or over the counter medication options, depending on what symptoms they're presenting in. But here's the thing, like one study found that 25% of people diagnosed with IBS actually had celiac disease, right? So if you have celiac disease, probiotics and fiber, not a bad idea. I think mostly everybody could benefit from probiotics, and a lot of people could benefit from fiber, but you're still going to have symptoms if you keep eating gluten. And so you really want to figure out if you have celiac disease because that's going to inform your treatment approach, right? And then the other condition that can affect 10% of people with IBS is inflammatory bowel disease. And that's a different treatment approach too. Again, this is not going to be helped by fiber. Actually, fiber can make inflammatory bowel disease worse in some cases. And so it's really very much, I would prefer if anybody had symptoms like weight loss or blood in their stools or any kind of diagnosis after age 50, that they make sure that they see a gastroenterologist because these can be red flag symptoms for IBD, cancer, celiac disease, and everybody deserves to have a proper workup. Now, I will say some gastroenterologists might find this, and this is going to be really helpful to figure out your treatment approach. But a lot of times too, other people, they might not get any kind of diagnosis other than IBS. And this is my hope for them. If they get this book, they can really figure out additional causes of IBS, including the small intestinal bacterial overgrowth and nutrient deficiencies. There's medications that can lead to IBS and so on and so forth. But, you deserve a better treatment than just taking antidepressants, laxatives, fibers, and antidiarrheal medications long term without resolution of your symptoms.
Yeah, I think that's the problem, treating the symptoms, not I mean, that's also with osteoporosis, it's just something I think that's really how a lot of medicine, they want to help you, they mean well, and they're really, but sometimes they forget to really dig deep and look at the root cause. And what I see in the people I work with osteoporosis is the doctors know about celiac disease. They really do. So everybody's tested for that, but that's it. They're not tested for gluten, other gluten issues. And it's so prevalent. It's such a big deal here in this community and really has an effect on bone health, as does everything of the gut. But it's something that, when they're getting the wheat Zoom or any of those tests, it's just unbelievable how many people, test positive for that. Do you see that? Do you see gluten sensitivity as a big issue as well?
Yeah, I would say gluten sensitivity is probably the top two sensitivities in IBS. So dairy would be the other one. And a great place to start for a lot of people is definitely, having the test done with their doctors, rule out celiac disease. But even if you don't have celiac disease, there's so many different ways that gluten could irritate your bowels, whether that is because it's a high FODMAP food, because you have non-celiac gluten sensitivity, you can have wheat sensitivity. Gluten is also, and wheat is a high nickel food. So for some people, they might have systemic nickel sensitivity, which is also a driver of irritable bowel syndrome. And so there's like so many different pathways to gluten being an inflammatory food, irritating food with IBS, that I feel like it's a great place to start. In my own healing journey, I had IBS and horrific acid reflux and bloating. And I started to, I tried different things, the fiber, the laxatives, the Imodium and all of the things. And within 3 days of getting off of gluten and dairy, my IBS and acid reflux and my bloating went away. I used to work out a lot, but I never had abs. I was always like, why? I'm doing all of these Pilates and exercise classes. What's going on here? And it turned out that I did have abs, just a lot of the bloating was covering them, right?
Wow. Yes, I see. So my husband wouldn't be alive had we not figured out his gluten issue, non-celiac. And he's a physician. He told me this story recently. You love this. A woman, what he has done, pay it forward when so he totally can't figure out someone who tells him that about his situation, which wasn't digestive issues. He had this chronic cough and other things. But anyway, and he'll say, try getting off gluten and then and also dairy, whatever. Anyway, he had a woman who he mentioned that too. 25 years of a chronic cough, and it went away like 2 days after stopping the gluten. Can you imagine? 25 years of coughing. It's
Yeah.
yeah, it's so crazy. It's so crazy. But what I love about the book, and I think what you found that people are able to do, you were able to really put together. You want to just share how you figured out how to organize this that people can really go through it and figure out or get a good idea of what they may have.
Yeah, definitely. So I went through a process of trying to figure out how to how to organize all the things, and as somebody that writes books, you kind of have a lot of information and you want to get it out in a digestible format. No pun intended. But essentially, I thought about dietary triggers being a really common thing for people, and so this might be a great place for people to start when they have IBS. It can be gluten and dairy. They're the most common reactive foods. For some people with fat malabsorption, they could be fatty foods. For people with inflammatory bowel disease, especially food additives and some of the um, sugar alcohols, they can be incredibly irritating and they can actually induce IBS and IBD. Other people might have oxalate issues. I know this can be very relevant for bone health or histamine issues. And so we go through a lot of the dietary triggers, and we eliminating them is kind of one part of the puzzle. Obviously, if you have celiac disease, you might require long-term elimination, potentially forever with the current therapies we have. With a lot of the other food sensitivities, I have found that we can reverse them and they can be temporary once we work through the root causes and triggers and optimize the digestive process. Example being oxalate issues. Some people might find that they need might think that they need low oxalate diets forever and ever, whereas they actually might have oxalate issues because they have a candida or aspergillus mold colonization in their digestive tract, coupled with a B6 vitamin deficiency. And so sometimes addressing the overgrowth and the vitamin deficiency can lead to like a normal metabolism of oxalates where they can still eat their beets and they can still, in moderation. I'm not saying like 75 beets a day, right? But they could still consume oxalate foods without those foods causing issues. And so that first chapter goes through a lot of the food reactions, how to figure out which ones you have. There's different tests you can do and kind of judging on your symptoms, and then also what to do about them. So not just eliminating, but like how do you support your body to properly break down foods? And then we get into digestive and digestive enzymes. These are other kinds of root causes of IBS, especially I see like fat malabsorption when people don't have enough lipase or ox bile on board, then they can really react to fatty foods.
I have a question on that. Would that show up? How would they see that? Like, how would someone, are there any symptoms well, besides reacting to fatty foods, is there anything else they might see in their stools or anything that might give them a hint of that?
So, a few different ways, things they could see. So they can have like pale colored stools. Sometimes they might see that. They might have like visible like oil or like greasy stools. So that kind of is another thing that they can present with. If they were to do like a lab test, they might see low fecal elastase. So elastase less than 500 on a fecal test. So those might be that can be a way that might show up for people. And really, a lot of times it just might be like, oh, I ate a lot of fatty foods and then my stomach really hurt. And then then I kind of had some explosive diarrhea. Not to give you TMI, but we are talking about IBS here, right?
Yeah, and it's so I think the more knowledge that people can have, because when you figure out or have an idea, then you can partner with your practitioner and really, really make a big difference. So I love that you've gone in such detail into everything in terms of how to figure out what might be causing your issues.
Yeah, absolutely. And then there's more. So there's deficiency of beneficial bacteria, excess pathogenic bacteria, sometimes called dysbiosis. There can be intestinal permeability, intestinal overgrowths, gut infections, alterations in stress hormones, thyroid hormones, and autoimmunity, inflammation, inflammatory bowel disease, and then toxins and chemical triggers. So there's a whole host of different things that can cause IBS. And then every one of them has a slightly different protocol. So, for example, if you have inflammatory bowel disease and that's the cause of your IBS symptoms, you're going to want to really focus on calming the inflammation and interventions like a semi elemental diet, squishy and mushy foods, high dose turmeric, serum based immunoglobulin, boswellia. These might be some of the methodologies on how to induce remission and stay in remission from inflammatory bowel disease. Whereas if you have like a parasitic gut infection, then you might benefit from herbal remedies for parasites or medications for parasites, right? So it's like my I'm very frustrated because most physicians will say like you have IBS, do this, right? And it's like, okay, but if your IBS is caused by SIBO, for example, eating a lot of fiber and taking probiotics might actually make you feel worse. And so we want to figure out what is the cause here because that's gonna really inform us. And I know I can get a bit of a soapbox on that.
No, I agree. I think it's so crazy. Oh, because people don't know. Oh, yes, I have IBS. They think it's just like I have a ear infection and I need this. You have IBS, take this. It's not like that. And I think it's so important that you're bringing out what it really is, all the many, many, I mean, sort of like osteoporosis. It's not one size fits all. There's so many different root causes, including all of the gut things. And we need to know what it is if we're going to treat it appropriately. So it's really the same type of thing. And everything they do for their IBS is going to help their bone health. So it goes both ways. So it's interesting in your book, you talk about there are some mistakes that people make because they try to fix their gut too aggressively. People, okay, I'm going to fix this. What things do you see that people are doing that's just too aggressive?
Well, I definitely find if they have like an inflammatory bowel disease, if they take high dose probiotics, or if they take, let's say, some herbal remedies like berberine that can make things worse for them. Another situation might be if a person has SIBO, they might try to do certain probiotics or a lot of fiber, and that can make things worse for them as well. And other, I guess, internet famous methods for IBS might be bone broth or an elimination diet or, again, probiotics, where these things can only take a person so far. So if you are glutamine deficient and that's the cause of your IBS, then bone broth can absolutely be helpful. But if you have histamine issues are usually caused by mold colonization or different bacteria or infections in your gut, then bone broth can actually make things worse. And again, it's kind of nuanced where I find people, people see gut health and even practitioners see IBS and then they think it's like the same protocol for everybody when it isn't.
Yeah, that's so good. I mean, reading your book is just so interesting to me because it really goes through everything. Even you want to just talk about the toxins and airborne toxins, how that can affect IBS, because I don't think that's anything people really think about too much.
So definitely toxins can be a hidden trigger for IBS. And we're exposed just to so many toxins on a day-to-day basis that we weren't many moons ago. I would say my definition of toxins includes medications too, because there are certain medications that are notorious for causing issues with gut health. I know opiates, for example, pain relief medications, they could lead to like really horrific constipation in some people. Birth control pills, specifically Yasmin, Yaz brand that contains drospirenone, a few other brands out there. These can have been studied to induce IBS. And then there's things that we might not consider or might not really be on our radar. For example, mold toxicity. So mold is airborne. When we have mold in our air, this can actually colonize our gut, and this can lead to a big alteration of our microbiome. People might not realize this, but penicillin was like derived from mold, right? And so we think about mold as something that can act as a toxin and an infection and also like an antibiotic. So if you have mold colonization in your body, it's like taking major doses of antibiotics for a long time, and that's going to really shift your microbiome. So some of the patterns might be you're going to be immune suppressed. And so any kind of gut infections are going to be able to propagate. Some people might have parasitic infections. They might have various types of pathogenic infections that are living in harmony with their microbiome. But once their gut immune is pathways are suppressed, then those pathogenic microbes are going to be able to thrive. As we know, mold can also impact our beneficial microbes, and so then the bad ones essentially outnumber the good ones. And so this is something that oftentimes happens, and I've seen in people with IBS where we're finding a lot of infections, and the infections just kind of don't go away on their own. Oftentimes, they might be mold exposed, and that mold exposure can cause dysbiosis and immune dysregulation in the gut and in the whole body, really.
Yeah. Now, the truth is, for people who've heard you before, know you, if you look at my bookshelf, I have your books over there. Everybody knows you as a thyroid pharmacist, and you really specialize, and you've written books on both thyroid and adrenal dysfunction. But what is the connection between thyroid and digestion? Because there is a large connection.
Well, it's definitely a two-way street. So we do know that hypothyroidism can cause things like slowed motility, low stomach acid, constipation. Interestingly, about 18.5% of people with IBS were actually found to have thyroid dysfunction. And sometimes subclinical hypothyroidism, kind of the early stages of thyroid dysfunction. We know that an overactive thyroid can really speed things up. So people might have some diarrhea that's associated with that. And really long-term hypothyroidism can lead to SIBO, small intestinal bacterial overgrowth, which is a trigger for IBS. And then the other way is we do know that IBS can lead to various nutrient malabsorptions, which then end up leading to thyroid dysfunction. I first kind of made that connection in my own healing journey because I had IBS first, and then I ended up with a Hashimoto's diagnosis. And then I was like, okay, there's this big connection between my symptoms. What's going on? Did one cause the other? And then I came across the work of Dr. Alessio Fasano, who mentioned that every case of autoimmune disease, and most thyroid conditions being autoimmune, needs to have three things in order for it to present, and that's going to be the right kind of genetic predisposition, triggers, and intestinal permeability or leaky gut. So we know that there's going to be a big gut component to every case of autoimmunity, and most cases of thyroid dysfunction, 90 to 97% of the time, are autoimmune.
Yeah, it's so interesting. When I was reading your book, one thing, because you've written about adrenal dysfunction, you're very much into the role that stress plays, which so am I. And I think it's something that you can't really heal yourself without addressing this component. But I thought it was interesting where there was a large percentage of people with TMJ that have IBS. And I thought, and I used to work with dentists in TMJ, and I thought, very interesting. I wonder if it's just the clenching and the stress, but that was such an interesting connection. I thought, who would have ever put that together?
Yeah, it's been really interesting as I was doing the research for this book. I I had known about the importance of gut health and stress and all of these different connections. And I worked a lot with thyroid patients. And then eventually I started to have people just referring other kind of conditions to me where they were like, well, you figured this out. Can you help this person with this other thing? And I'd be like, okay, I don't really know, but I'll try and I'll, learn along the way, I guess. And I was just surprised that so many different connections between gut health and various conditions. I know I saw something on the internet and it said, I had 99 problems, but healing my gut helped like 97 of them. And I'm like, that's so true because you're going to see better outcomes in anxiety. You're going to see better outcomes in depression, autoimmunity, osteoporosis, TMJ, all kinds of things when you really address gut health. And I just feel like, stress and gut, if you can get these two things dialed in, you're going to feel like significantly better for many people.
Yeah, that's why I also gut, you have to deal with that first. You cannot deal with the other things because so many things get better when you deal, just like you said, when you deal with the gut. So it's so important. So the end of your book goes through things you can do. Are there things you can share with the community that could, are there some general easy things that people could put into their life that could help them with their digestion?
Well, diet is definitely the first intervention that I recommend. And generally speaking, getting off some of the common inflammatory foods might be gluten and dairy. This can be a really quick way to feel better. Oftentimes, too, processed foods, just in general, like eating a lot of food additives, a lot of these foods that we're buying at the store, packaged foods, trying to eliminate those out of your life as much as you can. This is going to make a really big difference if you start cooking at home. I know for my husband, he was actually diagnosed with inflammatory bowel disease in 2018, right after the birth of our son. It was actually erythritol that was a major, major gut trigger for him. And this is one of those artificial sweeteners, non-caloric sweeteners, and it's added to keto foods. So like the keto foods you get at Costco, right? That are not like meat. And if you cook your own food and you're eating a keto diet, then there's a good chance you're going to be eating mostly real food, right? But when you start going to packaged foods, there's going to be additives that can be potentially irritating. So this is going to be like a really great place to start for a lot of people, just like focusing on eating a cleaner diet. And I know sometimes I work with people that already are eating a really clean diet. And I'm like, okay, at that point, we're not talking about eliminating more foods. I don't want you just eating ice cubes, but let's just figure out what else could be going on, right? Another part of it is supporting really good digestion. A lot of us these days, I feel like we're running around in a very stressed out fight or flight state. And when you think about the autonomic nervous system, when I learned about it in school, there were like two settings, right? There was like fight or flight, and then there was rest and digest. And rest and digest is like the parasympathetic setting when you're a little bit more calm. And that's kind of where you want to be when you're eating food, right? And so, not eating on the go, like definitely don't eat at your desk. Don't eat like when you're standing up, taking that time to be mindful with your food, taking a few deep breaths before you eat, chewing your food properly. This is going to go a long way to setting up your digestive process for success. Digestion starts in the brain, right? And then it goes into our mouth. As we chew our food properly, our saliva starts to produce digestive enzymes. And that's how we start our digestive process. When we miss some of these steps, then the food can essentially not be digested properly and cause constipation, diarrhea, digestive distress. And then again, for many people, depending on what kind of motility issues they have, I would kind of encourage them to figure out, let's say, if they have constipation, they might want to utilize something like carnitine, thiamine, potentially magnesium to help move things along. I prefer magnesium citrate form for people with constipation. If they had a diarrhea, I would consider doing something like Saccharomyces boulardii. This is a beneficial yeast that can be very helpful for clearing up diarrhea and a lot of gut infections that cause diarrhea. Potentially, zinc and glutamine are two additional nutrients that are commonly depleted in diarrhea. And then, of course, I would consider doing some testing, especially if your symptoms haven't resolved or if they've been with you for long term. One thing I do want to caution against is some people might find success with an elimination diet because, especially if they're doing like an extensive elimination diet, where they think, okay, the elimination diet resolved my symptoms. Therefore, it was foods that were the enemy. And I know I've seen this in the autoimmune community, people getting on like the autoimmune paleo diet, where they needed to eliminate gluten, dairy, grains, sparkling water, caffeine, alcohol, sugar, and so on and so forth. Where interestingly, like true food sensitivities shouldn't be more than like one or two foods that you react to, and a lot of times, if you have multiple food sensitivities, or if you have hit a plateau after you eliminate foods or some of the symptoms come back, this is a good indication that you might have like a serious gut infection, such as, a protozoal infection that is constantly causing intestinal permeability or SIBO. And so you would want to address those things properly because they're generally not going to go away with most diets. And essentially that trigger could still be living inside of your gut. And then you're basically just walking on eggshells.
How long when that if that's the case, if someone does the elimination, they feel better, how long will it be before then they start noticing the problems again, if it is due to an infection?
I would say if you hit a plateau 3 months or so, and you can't add in most of your foods back, then that would indicate to me there's something else going on, whether it's an infection or digestive enzyme deficiency. This is something you do really want to explore so that you're not basically withholding yourself from a lot of foods and still, you know, really shifting your microbiome. I see this oftentimes people get on the low FODMAP diet, which is one of the treatments for IBS, specifically for SIBO. And basically, when we have SIBO, this is an overgrowth of bacteria in the small intestine. And the small intestine is supposed to be relatively sterile without any bacteria. So when they do have bacteria there, these bacteria, whenever you eat certain foods, are going to produce certain gases that can cause a lot of digestive symptoms. And when you eliminate the foods, they're no longer producing those gases, which people are like, okay, I'm getting some symptom relief, but the bacteria are still there. So the diet doesn't starve them. The bacteria still stay there. And actually, not eating a lot of these diverse foods can end up lowering your microbial diversity, which further propagates the digestive issues. So an example with SIBO, and I have a whole chapter on this and the protocols and the testing and all of that to use. First, you would want to figure out why you have SIBO. It could be because you have low stomach acid. It could be because you have thyroid dysfunction or some other kind of motility issue. And you would want to utilize the proper treatment. Many times you need to use antimicrobial herbs, medications, or something called an elemental diet that truly starves off the bacteria in the intestine
No, it's
to
such a
get
point.
proper relief.
Because that diet is so hard. First of all, it's really a miserable diet for anyone to live with, and as you said, you're not getting so many of the nutrients that you need. But what I see all the time is people they might get the right treatment. They'll get the medication, they get the right treatment for SIBO, but the motility is not addressed. This is so common. I'm sure you see this all the time. And so I love in the book, though, you have a natural way you can sort of assess motility, which I thought was you want to just share that? Because you know, that was just an interesting way if someone's thinking, is motility my issue or not?
Yeah, one of the things they can utilize is like a natural motility test, and it's essentially eating some beets, eating some cooked beets, and then really watching your stools to see when you're going to see that red color. This is something you can use to track your bowel transit time. So Essentially, it can take anywhere from 12 to 48 hours for the changes in your stool color to appear after taking the food marker. So less than 18 hours is going to indicate that you might have malabsorption, diarrhea, or parasites. And if it takes more than 24 hours, this can indicate slowed gut motility. So it's kind of like I would eat the food, write down the time, and then you would watch your stools over the next 48 hours.
Oh, that was such an easy thing people can do, but yet do you agree that that's missed oftentimes? I mean, there's medication now that they put people on for motility, and people, the GI doctors are aware of that, but do you see that? I just see that sometimes the SIBO comes back because they were on the antibiotic, but they didn't address the motility.
Definitely. So SIBO is notorious for coming back. And a lot of times I'll see people that say, oh, I already went through a treatment protocol for SIBO. This can't be it. And actually, the recommendation is for them to test again for SIBO after doing a treatment protocol because you want to make sure you got all of it. So I think of SIBO as kind of like hair. And so you can take a protocol that cuts your hair, right? Just takes down a little bit of the SIBO, but you still have some left. And so you want to take a protocol that fully gets rid of all of the SIBO. There are different kind of units of measure used to determine how severe your SIBO is. And so you can essentially use the protocol, medication, herbs, elemental diet for a time period, and it can take you from severe SIBO to moderate SIBO, but you're still going to have SIBO. So you want to go from like severe to zero, and that oftentimes might take a lot more intervention. And then again, if you have that motility issue, then you're just going to keep getting yourself into a situation where you keep growing it back. And medications, low dose naltrexone is one I love that can be used to help with that motility. You can use digestive bitters, some mitochondrial support, so alpha lipoic acid can be helpful, as well as carnitine and thiamine can also be very helpful for motility. So there's different things that can be done to support that process. And a lot of times I feel people deserve to know that. Otherwise, they kind of just get into like a rabbit hole. Pure Encapsulations makes a product called Motil Pro that can be helpful. And there's a lot of I have a lot of products on the market there too.
Yeah, I think that's another thing in the book. You actually give numerous specific products for the different things that you're suggesting so that people can, use whatever they have a choice there of things that can be effective, which is really helpful because sometimes we don't know where to turn. Where do I get this? Do I go to Costco? Do I go to, where do I get this? So I thought that was really helpful. So what else would you like to share for people or anything that you would like to they've given so much information, and there's really, if this is you, I highly recommend the book because it's just packed with good information on how to figure things out, as well as all sorts of resources and ways that you can help yourself. But is there anything else I mean, we could go on, but is there anything else you'd like to share with everybody, or, you know, what did I miss that you'd like to tell people?
Gosh, we've covered so many great things. I think one thing I'd love to mention is that food sensitivities can be reversed. I used to think that foods were, once you had a food sensitivity, you were kind of stuck with it forever. But my recent, I guess, discoveries have been about how to reverse a lot of these food sensitivities. And so I have that covered um, in the first few chapters of the book, how to do so. And I've also created a comprehensive guide for people that they can get if they order the book when they go to thyroidpharmacist.com/IBS. That has one of the pre-order bonuses, which we'll leave up for Pub Week, um, that has the whole guide on how to get rid of food sensitivities.
Oh, that's great. Well, tell us about the bonuses because today the book is out. The day that this is being released, I was very lucky because I got a copy, a digital copy beforehand. So I was able to read the book, but it's actually coming out the same day the podcast is being released, which is so exciting. But I think that's wonderful. Tell everybody exactly what's besides the food sensitivities, what are in those bonuses.
So we have a food sensitivity guide that goes over all the things you need to do to get rid of your food sensitivities. I have a chapter on inflammation and inflammatory bowel disease. This was something that my husband was diagnosed, and I've seen, unfortunately, many people struggle with this for decades and have to have their colon removed and just go through a lot of health challenges. Thankfully, with the help of three of my really close friends, we were able to get him into remission really quickly, and he's been in remission for over 7 years now. These methods that we used for him have worked with countless of other people. So I'm just really hoping people can get that whole chapter and even, share it with their friends.
Can I just, could you just tell people what is under that IBD, inflammatory bowel disease? Can you just tell people what exactly is under that? Like what conditions?
Oh, yeah. Ulcerative colitis and Crohn's disease are two of the biggest conditions. And then microscopic colitis is oftentimes considered IBD as well. And so the same protocols will work for all three. And then the gut symptom solutions guide. So this goes over whatever symptoms you have, really how to address them properly.
Oh, this is great. So this is just wonderful. Thank you so much. Well, I'm just so excited because this is, again, too many people young too, all ages. This is the thing. So if your children are saying, "Oh, my stomach hurts," or you see they're constantly going to the bathroom, or I just can't get over how many young people I see and they just think it's okay, oh yeah, everybody has this. But there's so many people with osteoporosis and bone health issues who we have to address this. We can't not. You really won't get better. You might do things that help, but to really get to the root cause and really make a big difference, this is just an absolutely key component. So I'm really grateful for you for this book. And you just had a baby. For everybody here, Isabella has an adorable, she's 4 now, right? 4 months old, 4 months old.
Yeah.
Yeah. So somehow, I don't know, how did you do that, Isabella? A book, a little girl.
Well, yeah, I mean, it was funny because the baby was supposed to happen a few years ago. The book was supposed to come out last year, but just all happening all at once. So very, very grateful for all of that.
Yeah, I always find that, we try to control the timing in life. Never happens, but it just doesn't work. But anyway, somehow you got this great book out. I'm so excited that it's going to get right. But it's like another baby of yours, right? You're getting this out to the world. And unlike your other books, which, oh my gosh, so many people, it's changed their lives, the thyroid, all the books that you've done prior. So this is good. Right? How excited are you that get this out to the world?
I'm super excited to get it out into the world. So I'm hopeful that it'll reach the people that it needs to reach, because so many people are suffering with IBS.
Yeah, I can't wait. So people listening, if you get the book and you learn some things to do and it helps, please come, please let me know, let us know because it always makes me, I mean, that's why I do the podcast because I can introduce people to you and then they read the book. Oh my goodness, I had no idea. And then, everything gets better. So it's always just when I hear these things, how someone's life is impacted by a guest on the podcast, there's just nothing that makes me feel happier. And I know I just know people's lives will be changed from reading this book. So I think a lot of less people will suffer, which is what we want, right?
Absolutely.
Well, thank you so, so much for being here. I'll have all the links and for your bonuses and so they can buy it. They should go right to you. Just let's repeat that. The best thing for people to do who are interested in getting the book.
Definitely. They can get it on Amazon and Barnes and Noble or wherever fine books are sold. And they can also go to thyroidpharmacist.com/IBS to get some of the pre-order bonuses if they'd
Oh,
like.
that's great. Well, thank you so much. Always a pleasure to see you and good luck with the book.
Thank you so much for having me. I really appreciate it.
My pleasure. I hope you enjoyed my interview with Isabella as much as I did, and now have some new information on IBS and gut health. She shared so many tips that we can all put into our life, and our gut is so important. And dealing with this really makes a huge difference for our bones and overall health. All the links to the book that just came out will be in the show notes, as well as where you can go to get the free bonuses. And the last thing I just wanted to mention is my membership. It's the Happy Bones Club, and every month we have a Q&A with me as well as a guest expert, and they've been just so incredible. And the third thing is my happiness program, and I just think that's a big component of bone health as well as overall, we all deserve to be happy. But anyway, it's only $29 a month. So if you're interested, check it out, and then you get all the past classes as well. So there's so many classes, so many exercise classes. It's very comprehensive. But anyway, check it out. Just go to tinyurl.com/Happy Bones Club, and that will be in the show notes as well. So thank you so much for tuning in, and I look forward to seeing you on the next episode.